Welcome to the PubMed Daily Review for May 20th, 2026. Today we scanned 2,140 new open access papers. Here are the top 10 selected for detailed analysis. Trend 1 of 10, Longitudinal Studies of Health Outcomes. These papers longitudinally examine how diverse factors influence health outcomes across various populations. This cluster covers 184 papers. Representative work includes longitudinal associations between adherence to 24H movement guidelines and physical fitness and body composition in pediatric overweight and obesity, association of intrapartum epidural analgesia and oxytocin exposure with offspring autism and neurodevelopment from the Japan Environment and Children Study, and pain and depression mediate the relationship between multimorbidity and frailty in older adults with diabetes. Trend 2 of 10. Microbiome and Microbial Ecology. This trend investigates microbial communities, their diversity, roles, and detection methods across diverse environments. This cluster covers 204 papers. Representative work includes gut-Hi-C metagenomes of severe COVID-19 patients, bacteria and yeast involved in gut-lung axis, synthesis and anti-nutritional profile of novel thiazolidine, 4-1 derivatives, and molecular docking and molecular dynamic simulation studies, and full factorial construction of synthetic microbial communities. Trend 3 of 10, Clinical Practice and Health Outcomes. Research explores clinical practices, patient factors, and interventions influencing health outcomes in varied medical contexts. This cluster covers 294 papers. Representative work includes geographic variation and amputations for Medicare patients with diabetic lower extremity wounds, achievable benchmarks of care in pediatric emergency departments, and beetroot juice modulates physiological responses and accelerates recovery during the special judo performance, a randomized trial. Trend 4 of 10, Specific Cancers and Biomarkers. Researchers explore specific cancers, identifying biomarkers, molecular mechanisms, and advanced diagnostic or therapeutic strategies. This cluster covers 220 papers. Representative work includes update on laryngeal cancer, introduction, a systematic review of surgical outcomes and postoperative complications based on free flap selection for reconstructing primary or recurrent locally advanced laryngeal hypopharyngeal tumors, and mitochondria and liver cancer. Trend 5 of 10, Cell Biology and Molecular Pathways. This trend investigates cellular functions and molecular pathways governing biological processes, disease, and interventions. This cluster covers 271 papers. Representative work includes retraction. Methanol extract of Osmium gratissimum protects murine peritoneal macrophages from nicotine toxicity by decreasing free radical generation, lipid and protein damage, and enhances antioxidant protection. Cell-free adipose tissue-derived stem cell extracts mediate immunosuppression of lymphocyte via cell cycle arrest, and PRR33 protects against cardiac hypertrophy by regulating myocyte cytoskeleton remodeling. Trend 6 of 10, Health Psychology and Public Health. This trend examines psychological factors, health behaviors, and public health interventions across varied populations and settings. This cluster covers 280 papers. Representative work includes a computational text analysis of recent African digital health strategies and their attention to vulnerable populations, longitudinal associations between patterns of childhood adverse experiences and positive experiences in depression and anxiety symptom trajectories among college students, and surgeons' burnout during the medical crisis in Korea. Trend 7 of 10, Oral Health and Dental Science. This trend investigates oral anatomy, materials, diseases, and treatments, including systemic links and regenerative approaches to advanced dental science. This cluster covers 64 papers. Representative work includes maxillary sinus morphology and septa, a cadaver-based study, association between periodontal disease and rheumatoid arthritis, a systematic review and meta-analysis, and effect of calcium hydroxide removal protocols on push-out bond strength of hydraulic calcium silicate sealers, an in vitro study. Trend 8 of 10, Advanced Scientific Methods and Modeling. This trend unifies research applying sophisticated methods and models to analyze, predict, and optimize complex systems across diverse scientific and engineering disciplines. This cluster covers 260 papers. Representative work includes numerical modeling to assess the hydrodynamic behavior of the Galinas River in San Luis Potosí under atypical hydrometeorological conditions, novel calculation methods for geometrically accurate thread depth, and mechanochemical optimization and scope of triple and multiple Sonnegascher couplings of triethylbenzene for conjugated porous polymer synthesis. Trend 9 of 10. AI, machine learning, and data. This trend applies AI, machine learning, and data-driven techniques for analysis, optimization, and intelligent decision-making across diverse domains. This cluster covers 193 papers. Representative work includes risk-managed safety screening via stability-constrained reachability tubes for vehicle handling, automatic computation of breast cancer biomarkers for multiple formula, C-text, FFDG PET image segmentation, and mech-enabled load balancing framework for DFARS-aided wearable healthcare networks. Trend 10 of 10. Neurocognition, movement, and performance. This trend explores the intricate links between neurocognition, movement, and performance across health, disease, and aging. This cluster covers 170 papers. Representative work includes environmental pressure and sensory uncertainty modulate free throw performance, psychological, neurophysiological, and kinematic evidence, cognitive trajectories, and subsequent accelerometer-measured movement behavior in older adults, and sedative choice and neurocognitive outcomes after critical illness in early childhood. Up next, our first paper out of 10. Non-invasive spinal cord neuromodulation enables volitional anti-gravity leg movements after motor complete spinal cord injury. Responders versus non-responders by Raza N. Malik and Andrei V. Krasiakov from International Collaboration on Repair Discoveries, ICORD, Vancouver, British Columbia, Canada. Let's break down its key contributions. Spinal cord injuries can be devastating, often leading to complete loss of motor function. Transcutaneous spinal cord stimulation, or TSCS, is an exciting new therapy showing potential for motor recovery. However, we don't fully understand why some patients respond remarkably well while others don't, even with similar injuries. This study aimed to explore if TSCS could restore anti-gravity leg movements and identify factors distinguishing responders from non-responders. Researchers recruited 10 individuals with chronic motor complete spinal cord injury. Participants received lumbosacral transcutaneous spinal cord stimulation, or TSCS, for 60 minutes per session, 2 to 5 times a week, over at least 6 weeks. The primary goal was to assess if this stimulation could enable voluntary anti-gravity leg movements. They also looked for neurophysiological markers to understand why some individuals might respond better than others. The results showed that TSCS can indeed enable voluntary anti-gravity leg movements in people with motor complete SCI, with half of the participants demonstrating this remarkable recovery. Specifically, 5 out of 10 individuals became responders. While TAMEPs were only seen in one responder, a significant 80% of responders had a soleus H reflex, suggesting spinal reflex integrity might play a role. However, overall, consistent neurophysiological markers to clearly distinguish responders from non-responders remain elusive. This study provides compelling evidence that non-invasive spinal cord neuromodulation can restore some voluntary motor function in individuals with motor complete SCI, which is a significant step forward. However, predicting who will respond remains a challenge, highlighting the need for more robust biomarkers. Future research should focus on refining these predictive markers, potentially leveraging spinal reflex and peripheral nerve integrity to personalize and optimize TSCS therapy for maximum patient benefit. Up next, our second paper out of 10. Exercise suppresses breast cancer and reprograms the immune tumor microenvironment, cancer cell intrinsic features, and their interaction by Graham J. Colwyn and Leet W. Jones from Faculty of Health Sciences, Simon Fraser University, Burnaby, British Columbia, V5E1S6, Canada, Center for Heart-Lung Innovation, St. Paul's Hospital, Vancouver, British Columbia V6Z1Y6, Canada. Let's break down its key contributions. Good morning, everyone. Today, we're diving into a fascinating study that explores the powerful link between exercise and breast cancer. We know that physical activity can improve outcomes for cancer patients, but the precise biological mechanisms behind this benefit, especially at a molecular level, have remained largely a mystery. This paper set out to change that by meticulously investigating how exercise impacts breast cancer progression and what's happening inside the cells and their environment. To unravel these mechanisms, researchers employed a robust basic science approach. They utilized various syngeneic mouse models of breast cancer, including the 4T1 and MET1 lines, allowing for controlled in vivo studies. Their methodology was comprehensive, involving advanced techniques like unbiased transcriptomic and metabolomic analyses, alongside detailed cellular and proteomic interrogations, to capture a holistic view of exercise's impact. The goal was to identify specific changes within the tumor microenvironment and the cancer cells themselves, shedding light on both extrinsic and intrinsic cellular responses. The results were quite compelling. The study found that exercise significantly inhibited breast cancer growth and metastasis across multiple mouse models, a truly striking finding. Importantly, exercise led to a decrease in tumor-associated macrophages within the tumor microenvironment, while simultaneously promoting an activated anti-cancer innate immune cell gene signature. Furthermore, they observed broad transcriptomic reprogramming within cancer cells, including the downregulation of key metabolic pathways and a decrease in critical metabolites like NAD+ and lactate. These findings paint a clear picture of exercise's multifaceted anti-cancer effects. So what's the big picture here? This research provides compelling evidence that exercise isn't just generally good for you. It actively suppresses breast cancer progression by profoundly reprogramming both the immune cells surrounding the tumor and the cancer cells themselves. While these are exciting preclinical findings, it's crucial to remember that human clinical trials are needed to confirm these mechanisms and translate them into patient care. Looking ahead, understanding specific molecular players like HMGB2 and CTF1 could pave the way for innovative therapies that harness the anti-cancer power of exercise, even for those unable to exercise. Up next, our third paper out of 10, Association of Intrapartum Epidural Analgesia and Oxytocin Exposure with Offspring Autism and Neurodevelopment from the Japan Environment and Children Study by Asaka Tachi and Japan Environment. Children's Study Group from Department of Occupational and Environmental Health, Graduate School of Medical Sciences, Nagoya City University, 1 Kawasumi, Mizuho Cho, Mizuho-ku, Nagoya, for 678601 Japan. Let's break down its key contributions. Hello, everyone. Today, we're diving into a study that explores a critical question. Could common labor interventions like epidural analgesia or oxytocin exposure impact a child's risk of autism or neurodevelopmental delays? With neurodevelopmental disorders on the rise, identifying potential early life influences is incredibly important for public health and parental counseling. This study utilized a large-scale, longitudinal birth cohort from Japan, following over 72,000 children from birth up to 4 years of age. Researchers meticulously categorized exposure during labor into groups: no exposure, oxytocin only, epidural only, or both. They then assessed the children for autism and neurodevelopmental delays using standardized questionnaires to identify any potential associations. The key findings revealed a significant association. Children exposed to both epidural analgesia and oxytocin had a 2.35 times higher odds of autism. Similarly, those exposed to epidural alone had 2.41 times higher odds. Interestingly, this association was primarily observed in males. However, no consistent link was found with other neurodevelopmental delays, and the E-value suggested only moderate robustness to unmeasured confounding. So, what does this mean for clinical practice? This study suggests a potential link between common labor interventions and autism risk, particularly in male offspring. However, it's crucial to remember that these findings are observational and may be influenced by unmeasured factors. Therefore, while intriguing, these results highlight the urgent need for more robust, independent studies to confirm causality and ultimately guide clinical decisions regarding intrapartum care. Up next, our fourth paper out of 10, Precision-Guided Therapy in H3K27, Altered Diffuse Midline Glioma by Campbell J. L. McKay and Dong'an Kwong from the Royal Children's Hospital, Melbourne, VC, Australia. Let's break down its key contributions. Hello, everyone. Today, we're diving into a crucial question. Can precision-guided therapy, or PGT, make a difference for children battling H3K27, altered diffuse midline glioma, a very aggressive brain tumor? While PGT has shown promise in other high-risk cancers, its impact on this specific, challenging condition remains unclear. This research aims to shed light on whether tailoring treatments based on molecular profiles can improve outcomes for these vulnerable patients. This study was a prospective cohort study, part of the Australian PRISM clinical trial, enrolling 68 children with H3K27 altered diffuse midline glioma. Researchers performed comprehensive molecular profiling, including whole genome and RNA sequencing, to generate precision-guided therapy recommendations. They then compared outcomes for patients who received these tailored therapies against those who did not, or received standard care, focusing on survival and response rates. The goal was to see if this personalized approach truly made a difference. The results showed that 48% of patients receiving precision-guided therapy achieved a complete or partial response, while the overall median survival difference between PGT and non-PGT groups wasn't statistically significant at 21.3 versus 12.1 months. A crucial finding emerged. Patients who received PGT after tumor progression experienced significantly improved overall survival with a p-value of 0.007 and better progression-free survival with a p-value of 0.001 compared to those receiving unguided therapy. This suggests a specific benefit in a challenging clinical scenario. In conclusion, this study demonstrates the feasibility of implementing precision-guided therapy for children with diffuse midline glioma. While an overall survival benefit wasn't seen across the board, the significant improvements observed when PGT was initiated after tumor progression are highly encouraging. This highlights the importance of optimal timing and patient selection. Moving forward, larger studies are needed to confirm these findings and further refine how we integrate personalized medicine into the treatment of this devastating disease. Up next, our fifth paper out of 10, Implicit Bias in Safety-Aligned Large Language Models, a multifaceted evaluation of clinical decision-making and health equity by Qiufeng Jia and Yufeng Yu from College of Nursing, Chengdu University of Traditional Chinese Medicine, Chengdu, China. Let's break down its key contributions. Large language models are rapidly being integrated into healthcare for critical tasks like clinical decision support. While these models often pass explicit tests for social bias, there's a growing concern that they might still retain implicit biases. These hidden biases, if present, could subtly influence medical decisions and potentially worsen health disparities, making this a crucial area of investigation. Our study employed a descriptive cross-sectional design to systematically evaluate implicit biases. We analyzed 10 mainstream large language models, including both proprietary and open-source versions. To do this, we constructed 24 medical bias datasets across 6 high-stakes categories. We then used 3 distinct methods: the LLM word association test, the LLM relative decision test, and paired prompt analysis to uncover and measure these biases. We found that all 10 models exhibited systematic implicit biases across every category we tested. The strongest biases were observed in areas related to race, with a mean IAT bias of 0.61 and socioeconomic status at 0.56. Crucially, these stronger implicit associations significantly predicted discriminatory choices in downstream medical decision tasks, with a p-value less than 0.001. Interestingly, even advanced reasoning capabilities like chain of thought did not significantly reduce the magnitude of these biases. This study reveals that current safety alignment techniques are insufficient to eliminate implicit biases in medical large language models. These latent biases are not benign. They directly translate into biased decision-making, which poses significant risks to health equity. Moving forward, it's critical that LLM developers prioritize deep representational debiasing rather than just superficial alignment. For clinicians, this means embracing AI vigilance, viewing algorithmic outputs as fallible second opinions, ensuring human judgment remains the ultimate safeguard for equitable patient care. Up next, our 6th paper out of 10, Integrating Speech Biomarkers and Large Language Models for Adolescent Suicide Risk Detection with Mobile Application for Real-World Evaluation by Chang Lei and Runsen Shun from Vank School of Public Health, Tsinghua University, Beijing, China. Let's break down its key contributions. Adolescent suicide is a devastating public health crisis, and finding effective ways to identify at-risk youth is paramount. This research tackles that challenge by exploring a novel approach, using speech patterns combined with advanced AI to detect suicide risk. Researchers designed a two-phase study. They first developed their model using speech recordings from over 1,200 adolescents in structured settings. Then, they rigorously tested it on a separate group of 460 adolescents, collecting data naturally through a mobile app to see how it performed in real-world conditions. The results were very promising. The model achieved an accuracy of 0.808 and a macro F1 score of 0.807 for suicide risk detection. Importantly, it performed best on self-introduction tasks and maintained its effectiveness even when data was collected naturally through a mobile application. This study highlights a significant step forward. Integrating speech analysis with AI can provide a scalable tool for early suicide risk detection in adolescents. The success of the mobile app approach opens doors for widespread, naturalistic screening. Future work should focus on clinical implementation and assessing its real-world impact on saving lives. Up next, our 7th paper out of 10, The Neurotoxic Legacy of CAR T Cells. Where do we stand? By Simona Pagliuca and Pier Paolo Sorrentino from Service de Hematologie Clinique, Charrier de Nancy, Rue du Morvan, Vendouvre-les-Nancy 54500, France. Let's break down its key contributions. CAR T-cell therapy represents a groundbreaking advance in treating various malignancies, offering curative potential where options were once scarce. However, its widespread use is significantly hampered by severe side effects, particularly neurotoxicities. These neurotoxic events, ranging from mild symptoms to life-threatening conditions, are complex and challenging to anticipate. Understanding and managing these toxicities is crucial for the continued success and expansion of CAR T therapy. This paper is a comprehensive review, synthesizing the current evidence on CAR T-cell neurotoxicities. It delves into the epidemiology, underlying mechanisms, and monitoring strategies for both classical ICANS and newly recognized non-ICANS syndromes. The review's primary goal was to offer a fresh perspective on developing integrated, multimodal risk models. This approach aims to improve patient stratification and enable more timely interventions across various CAR T indications. The review revealed that CAR T neurotoxicity presents a broad spectrum, from mild aphasia to severe outcomes like coma and death. Importantly, it identified emerging non-ICANS neurotoxicities, such as delayed movement and cognitive issues, particularly with BCMA-directed CAR T. The underlying pathophysiology is multilayered, involving cytokine surges and blood-brain barrier disruption. Despite active research, most biomarkers for prediction remain investigational, lacking clinical utility. This emphasizes the complexity and ongoing challenges in managing these severe side effects. This review underscores that CAR T neurotoxicity is a complex and evolving challenge, demanding a nuanced approach beyond just ICANS. Clinicians must be aware of the broadening phenotypes and the need for indication-specific monitoring. A critical limitation is the current lack of validated biomarkers, making prediction difficult. Moving forward, the field needs to prioritize developing integrated, multimodal risk models to enable more precise patient stratification and timely, effective interventions, ultimately improving patient safety and outcomes. Up next, our 8th paper out of 10, EV-103 dose escalation/cohort, 5-year follow-up of enfortumab vedotin plus pembrolizumab in previously untreated locally advanced/metastatic urothelial carcinoma by J. E. Rosenberg and M. I. Malowski from Memorial Sloan Kettering Cancer Center, New York, USA. Let's break down its key contributions. Today, we're diving into the 5-year follow-up of the EV-103 study, focusing on enfortumab vedotin plus pembrolizumab for patients with advanced urothelial carcinoma. This is a crucial area because many patients can't tolerate standard cisplatin chemotherapy, and we desperately need effective, long-lasting alternatives. This paper aims to shed light on the long-term safety and efficacy of this promising combination. This study was a 5-year follow-up of Cohort A from the Phase IB/2 EV-103 trial. Researchers enrolled 45 cisplatin-ineligible patients with previously untreated locally advanced or metastatic urothelial carcinoma. Patients received enfortumab vedotin and pembrolizumab every 3 weeks. The primary goal was to assess safety, with key secondary endpoints including objective response rate, duration of response, progression-free survival, and overall survival over this extended follow-up period. The results were quite impressive. The confirmed objective response rate was a high 73.3%, indicating a significant proportion of patients responded to treatment. Crucially, the median overall survival reached 26.1 months, and an estimated 41.5% of patients were still alive at 5 years. Importantly, no new safety signals emerged during this extended follow-up, reinforcing the manageable safety profile of this combination. This 5-year follow-up provides compelling evidence that enfortumab vedotin plus pembrolizumab offers sustained, long-term benefits for patients with previously untreated cisplatin-ineligible urothelial carcinoma. The consistent safety profile and impressive 5-year survival rate solidify its role. These findings, combined with other recent data, firmly establish this combination as a new standard of care, offering a vital treatment option for a challenging patient population. Up next, our 9th paper out of 10. High-depth whole genome sequencing of premalignant breast lesions reveals rearrangement hotspots and personalized management opportunities by Lucia Kmalova and Serena Nick Zainal from Department of Genomic Medicine, University of Cambridge, Cambridge, UK. Let's break down its key contributions. Today, we're diving into a fascinating study on ductal carcinoma in situ, or CIS, a non-invasive breast lesion. While often detected by mammography, it's incredibly challenging to predict which CIS cases will actually progress to invasive cancer. This uncertainty frequently results in patients undergoing unnecessary surgeries or radiation. Our research question is whether advanced whole genome sequencing can shed light on the biology of these lesions and identify personalized treatment options. To tackle this challenge, researchers employed a sophisticated approach. They utilized high-depth whole genome sequencing on a cohort of premalignant breast lesions, specifically focusing on high-grade CIS. The goal was to meticulously map the genomic landscape. This powerful technique allowed them to identify specific genomic locations, or shores, that are highly susceptible to structural variations, potentially driving disease progression. They also looked for unique therapeutic vulnerabilities. The study yielded exciting results. They successfully identified specific genomic locations, which they termed shores, that act as hotspots for structural variations, likely initiating the evolutionary process of these lesions. Crucially, the sequencing also uncovered individualized therapeutic vulnerabilities that would have been missed by standard methods. These findings highlight the potential for a much more precise approach to patient stratification, moving beyond current broad classifications. So what does this all mean for patients? This research suggests that high-depth whole genome sequencing could revolutionize how we manage CIS. By identifying these genomic hotspots and personalized vulnerabilities, we might finally be able to differentiate between truly aggressive lesions and those that pose little risk. This could lead to more targeted therapies for high-risk patients and spare low-risk individuals from unnecessary interventions, ultimately improving patient care and reducing overtreatment. It's a significant step towards personalized medicine in breast cancer prevention. Up next, our 10th paper out of 10, Machine Learning Prediction Model for Dyslipidemia and its association with atherothrombotic events in 3 independent cohorts from South Korea, Japan, and the United Kingdom. Algorithm Development and Validation Study by Tae-Hyun Kim and Dong Kian-yan from Center for Digital Health, Medical Science Research Institute, Kyunghee University Medical Center, Kyunghee University College of Medicine, 23, Kyunghee-ro, Dongdaemun-gu, Seoul, 02447, Republic of Korea. Nyolcvan kilens 60 0 Let's break down its key contributions. Dyslipidemia is a widespread and complex health issue, and predicting who will develop it is a major challenge. While machine learning offers powerful tools for prediction, there's a real gap in models that have been rigorously tested and proven effective across different global populations. This study stepped up to address this, aiming to create a robust prediction model and see if its predictions truly link to serious cardiovascular outcomes. The researchers utilized an impressive dataset, drawing from 3 large, independent cohorts across South Korea, Japan, and the United Kingdom. They developed a machine learning model using 23 common health screening features to predict the 5-year risk of dyslipidemia. Crucially, they didn't just stop at prediction. They also investigated if the model's risk scores were associated with serious outcomes like heart attacks and strokes, providing a comprehensive view of its clinical relevance. The model showed promising results. achieving an OROC of 0.783 in the discovery cohort and maintaining moderate performance in external validation cohorts, with an OROC of 0.744 in Japan. Even more importantly, a higher model predicted risk for dyslipidemia was strongly linked to future cardiovascular events. Specifically, individuals in the highest risk tertile had over twice the risk of acute myocardial infarction and cerebral infarction compared to those in the lowest risk group. This study provides a significant step forward by developing and validating a machine learning model that can predict dyslipidemia using readily available health data across multiple countries. The strong association between the model's predicted risk and actual cardiovascular events highlights its potential clinical utility. Moving forward, the next crucial step is to investigate how this model can be effectively integrated into clinical practice to improve early risk identification and guide personalized preventive interventions for patients. That's all for today's PubMed Daily. If you found this helpful, please leave a comment, and subscribe for daily paper summaries. See you tomorrow.